The Henry Jackson Society, which I'll go into, have released a report bashing the data coming from the Hamas-run Ministry of Health in Gaza. They released this 40-page report detailing why we shouldn't rely on the health ministry of Gaza with respect to their death toll data that they released. This is released by Andrew Fox. Andrew Fox been releasing a lot of misinformation. Now, I don't want to go back into the background of Andrew Fox, and I don't want to go on who is actually backing the Henry Jackson Society. Let's approach this from a unbiased view of analyzing this report. And I'm going to quickly analyze this report to show you how ridiculous this report is. And it's so ridiculous that I'm very surprised actual media companies took it on board and released this report. The New York Times took this report and released it. The Telegraph included this report in their reporting. And I just want to show you why this report, what are the weaknesses in this report regarding challenging the data of Hamas. And before I do that, let's admit one thing. To assume that during one of the worst bombardment any jurisdiction has seen, like Gaza has seen, to assume that during this period where the communications were destroyed, where the energy sector was destroyed within the first 3 months, where nearly 60% of all medical facilities were at least damaged or destroyed in the first 3 months, to assume during this period that there's not going to be errors is obviously silly. Of course there's going to be errors. But what they actually prove over here in this report is that even though they were errors, those errors were actually corrected. If anything, people who actually read this report will come out of it having more trust than they did before regarding the Ministry of Health in Gaza and their credibility in releasing the data. Now, do I have 100% trust in the Ministry of Health? And, do I think everything that they've said is correct? I don't think so. But is the majority of their numbers correct? Let's find out. So the report details that there are 3 sources where the data for the death toll came. Hospital records registered by medical staff, unknown information sources, and they go into the report saying this was very limited in terms of data coming from information sources, and the public submission of information or family notification, i.e. family notifying this Ministry of Health of members that have been killed. Those are the 3 sources. The Gaza Health Ministry has issued Martyrs to Date fatality lists of the people killed in the conflict periodically since 27 October 2023. This started, remember, on the 7th of October 2023. And they list the name, the age, the sex, and the national ID number of each fatality. These ID numbers derive from the Gazan population register and are issued to anyone born in Gaza. They should have said that this Gaza population register is co-managed by Israel. Israel actually has to approve the issuing of these ID numbers, and therefore Israel has the details of every single person that's included in this list. They have that. Now, and this is the great thing about this report, is they actually are forthcoming with a lot of things that goes against them, really. And this is a great one over here. At the start of the war, the Ministry of Health used its existing collection system, the Health Information Center. This relied on hospitals and morgues to certify the deaths. However, as the ground invasion progressed, the Ministry of Health network connecting hospitals collapsed in November 2023. i.e., from November, the system that the hospitals connect to get a lot of their data collapsed, i.e., it was destroyed by Israel. This meant that hospitals lost access to the civil registry. So details had to be entered by hand. And this led to thousands of recording errors, as you would expect. If they cannot connect online to this civil registry where the data of each individual is in terms of their age, in terms of female, male, in terms of their ID numbers, it's going to be hard to identify the people that are dying and get all the correct data. And they had to do it by hand because the connection was lost. So obviously there's going to be thousands of errors. Now, they say the network was restored from February 2024, meaning that the Health Information Center had the opportunity to correct these errors, such as missing identity numbers or birth dates. The August 2024 list, which is the last list that they looked at, this report, so a significant improvement in terms of corrected data. So what they're saying is that there were incorrect data because of the hospitals not having access to this registry of the people. And a lot of them were corrected once they were connected. It took them a while. Obviously, they are going through a war. But in the August 24 list, some of them were corrected. However, throughout this process where a date of birth has been missing, that death has been recorded and therefore reported as a child. So he's recognizing that, in a lot of cases, they give examples of here, not in a lot, but in some cases where they don't know the date because they don't have access to the registry, they put 0 or 1. And then he gives examples that this was actually corrected later. So, for example, here, following the man on row 7,648 of the 30 April 2024 list was identified as a 4-year-old child. He's recorded in the population registry as a male added age 23, and this has been corrected to age 2022 in the 31st August 24 list. He's actually proving that they actually went and corrected their mistakes. And then he goes to the men recorded as women. So there's this whole thing that they want to record. Gaza wants to record more deaths for women because it shows that people care more about women and children deaths, right? So here he says in August 2024 list, 103 names were marked as female who had a male first name. 103 names. Out of how much? From 44,000 names. That's how systematic these errors were. 103. The errors serve to artificially increase the numbers of women and children. It's like, dude, it's 103. I mean, if they wanted to artificially increase the numbers, they would have more than 103 errors. So basically, because there's errors, you cannot rely on this data. It's like, okay, but are you making the assumption that there's not going to be any errors when the system is down, when the destruction is happening, when 60% of medical facilities were either destroyed or damaged, when the electricity was gone, communication centers were destroyed? This is in the first 3 months, right? Complete destruction happened. And then he notes that at the beginning, the Ministry of Health was recording all from hospital records, but then it was hospital records and also family notifications. But he's saying that the family reporting didn't have complete data. And that's true, that the family notifications, so there was kind of 3 sources. There was the hospital records, i.e. medical staff, people who came to the morgues or the hospital, they registered them. It was registered by medical staff. That was pretty much accurate. Then the family notification is very hard to know whether that's accurate or not because it relied on the family to notify missing people, right? But the family notifications, you find out later, is only 16% of the whole death toll list. So it's a small number, but it is difficult to confirm the data because it's relying on the families to notify. Here, the most recent list, published in September 2024. So I made a mistake. I said the last list they looked at was August. It's in September 2024. It doesn't specify the date. Contains 34,000 names. 80% of those lists on the list were from the Ministry of Health records account. 16% were by family members. 3% were judicial committee, reports approved by the judicial committee. And then there was a House committee of 316 names, less than 1% of the list. We didn't have information of what this means, of who approved this list. And then he makes the point of, well, hang on, there's a big difference between the family notifications and what's been recorded by the Ministry of Health in terms of the ratio of male to female, and kind of indicating that maybe the Ministry of Health is actually lying and the families are not lying, because men accounted for 62% of the family reports versus 42% in the Ministry of Health records. And then he's like, can this be explained by selection bias, making the deaths of men more likely to be reported by their relatives? And then he actually admits that this is exactly what they claimed in Sky News interview, Ministry of Health or Ministry of Media, in April, when he said that the family notification system that's being used to report the deaths is mainly used by widows who must formally register their husband's deaths to obtain government assistance. So then he concludes that together these anomalies provide a strong indication that at least some aspects of the Ministry of Health records are distorted, and the actual demographic breakdown of the fatalities data is much closer to that of family reports. That is around 60% men, 16% women, 24% children, at least during the period starting from January 2024, when the family report submissions began. I don't know why he makes that conclusion. He doesn't explain why he makes that conclusion. He actually went against that conclusion before by saying it's likely the Ministry of Health made a point that it's the widows that make those family notifications. So obviously it's going to be more male oriented. And second of all, if it's hospital registered, it's likely that it's going to be families that were the whole family attacked, because otherwise, if the whole family is attacked, then a family member would survive, and then they would be notifying and using that other system to notify the Ministry of Health. But if the whole family is attacked, they're going to go to the hospital registered. They're going to be registered by family notification. And so there is no reasonable support for that conclusion to say that the hospital registered is wrong. He's just making this up. He then makes the point that there's a lot of statistical anomalies in the first few months of the war. So he gives examples where, in 19 October 2023, there's 3,785 fatalities, where 2 days prior to that, there was only 3,000. So that's a 785 increase in the number of fatalities. But then he says the number of children reported killed increased by 671 on the same day, which means the majority of that increase of 785 in 2 days was mainly coming from the children death. And he gives these examples, and then he says, on the face of it, these statistical releases appear to be inconsistent and plausible. There may be reasonable explanations for these anomalies. For example, it may be that there is a time lag between different aspects of the reporting, but they haven't explained that. And he actually, being the fact that he said things have been corrected, whether that is the sex, whether that's the age, it's clear that it's possibly that there is a time lag happening, given the situation of many people coming in at the same time, and they didn't have access to the civil registry straight away. It took a while to identify the date of birth for a lot of these people. And then they corrected some of them. If there were a lot of errors, we should have seen in this report multiple examples of how that happened, not 103 cases where it was supposed to be male and then they registered as female, and then some of it was even corrected later on. And then he talks about the age variation. He basically says, we looked at 1,000 names and over 100 people whose ages had been reduced by 1 year between the October and July lists. So some people, they showed 19 in the April, but in the June list, that was reduced to 18, or 18 was reduced to 17. So there were some mistakes there. But how many of those were mistakes? Some of them were reduced from 19 to 18, which makes no difference because the children are under 18s. So how many of those were actually incorrect? Well, 117 people listed at 18 years old. Of these, 25 were listed as age 17. So 25 people got their age reduced from 18 to 17. What they're trying to do over here is they're picking on errors that are so small, but saying, see, if there's an error here, you can't rely on any of this report. And it's like, of course there's going to be errors. I mean, Israel, when 7 October attacks happened, they released the numbers and then they had to revise it constantly until weeks later, until they actually identified the bodies, identified the sex of the bodies. It took a long time. And Israel didn't have its communication destroyed, the medical facilities weren't attacked, and it still took them a while to identify the people, and they kept on revising their list. And he says over here, in the most charitable interpretation of this data, these names were incorrectly labeled as 18-year-olds in the previous list and then reverted to their true ages in the August list. However, even if this is true, it means that data in those previous lists released by the Ministry of Health was highly inaccurate and should never have been used uncritically by media outlets. So his point is basically, look, there are errors, which I don't think anyone thought there were not going to be errors, but the media should have said that there might be errors in the reporting. It casts significant doubt on the reliability of the current and future Ministry of Health list. Why does it cast significant doubt? Well, because there were 317 people listed at 18 years old, and of these, 25 were listed as age 17 in another future list. Then they say, well, some of these deaths might be Hamas-related deaths, and they give one example where it was confirmed it was a Hamas death. Sure, there might have been some Hamas deaths in there, and some, I'm sure the Ministry of Health it will be difficult for them to identify which one is which. But to say that a lot were as a result of Hamas-related deaths is a bit silly when Israel completely demolished the whole place. This is the best one, the natural deaths. So they say before 7 October, there were about 5,000 natural deaths in Gaza. That was happening unrelated to the war. And because the Ministry of Health has not issued any information regarding the natural deaths in Gaza, it hasn't issued a separate list, there is evidence that the deaths from natural causes have been included in the civilian war fatality data, having the effect of inflating the overall figures. How? We don't have any support for that. We just know that there were 5,000. And even though Ministry of Health said that this list is in relation to deaths from war, they are assuming that that's incorrect and the 5,000 are included in that list. Literally making that statement. They had only this paragraph in there without any explanation to why they've made that conclusion. They're just finding ways to reduce the number. And the last biscuit is this whole cancer patients recorded as war fatalities, whereby they give examples of when some cancer patients, the Ministry of Health released a list of all the cancer patients that they have. However, it seems like 3 of them, or a couple more, were on a different list before that indicated they died. So how could it be that they're on another list of cancer patients that are alive, but also on a list that they are dead? It's like there could have been some miscommunication between some teams indicating who has died and who hasn't died. That happens in war. And in fact, as I indicated, Israel took a while to even correct, to give us a final version of their death toll of who's alive and who isn't, of who's injured and who's dead. They could have made those mistakes. But you can't say just because there were 5, well, all 3 of these people were apparently alive in the middle of April when their names were included in the medical treatment list. So the inclusion of their names in the March fatality list, which is a month before that, is an obvious error. This is a small sample, but corroborates the wider patterns of fabrication identified in this report. If anything, I have come out of this report thinking the Ministry of Health has more credibility and more trust, because I thought they'd be making a lot more errors in their death toll. The fact that they actually corrected some of their mistakes once they got connected to the civil registry because they lost connection to the database of all the people that are dead indicates that they're trying to give you the most accurate data that they can give you, given the situation of their medical facilities being bombarded, the communication system lost. It was a war zone, absolute destruction of 3 months of an unprecedented bombardment in terms of speed and magnitude of destruction within especially the first 3 months, 3 to 4 months. So what this report does is finding these small errors here and there and saying, well, there's an error, so you cannot rely on this report. It's like, well, whatever report is going to come out of a war zone is going to have some errors in it. The Israeli report that came out after 7 October in terms of the death toll had errors in it. Can we say that we cannot rely on that, even though some of it was corrected later on? No. The only credit I'll give to this report is in relation to the ratio of women and children dying versus the men dying. In initial list, one of the initial lists that the Ministry of Health released, it showed that 70% were women and children and only 30% were men. But in an August list, the Ministry of Health itself corrected that and showed that 55% were women and children and 45% were men. I mean, it was the Ministry of Health that corrected that. The issue was that some media agencies looked at the 70% and took that on board to say that is the case, when in fact it wasn't. It was a bit over-exaggerated, and it's understandable that happened due to the situation of the war and kind of the loss in the access to the registry. And we saw some errors, obviously, when Israel released their lists of the 7 October attacks. So it's reasonable that these errors happened during the chaos that ensued. But the fact that it was the Ministry of Health that corrected that indicates that they are trying their best to correct the errors that they have, given the situation they're in. And it's interesting that this report is actually, I think, the opposite of what it intends to do. If you did like this analysis, do like and follow or subscribe. Thank you very much.